Hi, my name is John Choi. This is my validation video for maintenance of a continuous peg feeding. Before any procedure, I'm going to check the physician's orders, I'm going to wash my hands, organize my equipment, introduce myself to the patient, identify the patient, I'm going to explain the procedure to the patient, and provide privacy. Hi, my name is John Choi. I'm a student nurse, and I'm here to be your nurse today. Can I please check your armband? Could you please tell me your first name, last name, and date of birth? Okay, thank you. Today I'm going to be maintaining your continuous peg feeding. I'm going to provide some privacy. Next, I'm going to assemble my equipment. I have an irrigation set. I have tap water, a protective pad, and clean gloves. I'm going to wash my hands and apply clean gloves. Next, I'm going to discontinue the feeding. I'm going to turn off the feeding. I'm going to make sure that the patient is at a 45-degree angle. And I'm going to raise the height of the bed to my working level. Are you feeling any nausea or abdominal distension? No? Okay, great. Next, I'm going to assess the patient's bowel sounds. Okay, I heard normal bowel sounds, so I know that everything is okay. If I didn't hear any bowel sounds, I would stop the feeding and notify the physician. Next, I'm going to place a protective pad. I'm going to kink the G tube and remove the feeding. Next, I'm going to aspirate the stomach contents. I got 30 cc's of stomach content, so I'm going to check the color, consistency, and odor. And then I will reinstill the stomach contents back into the patient. If I aspirated more than 100 cc's of stomach content, then I would not reinstill the stomach content. I'll discontinue the feeding and I'll notify the physician. I'm going to kink the G-tube. I'm going to instill and flush the G-tube with 30 cc's of tap water.
If you wanted to, you could add the program. You see, like when you do
Then I'm going to kink the G-tube. And I'll reconnect it to the feeding. Then I'm going to return the patient to a comfortable status. turn on the feeding and make sure the patient is comfortable. Lower the height of the bed. Okay, I'm going to take my irrigation set and clean it, label it and date it, and store it in a clean area because it's good for the next 24 hours. If the patient needed more feeding, I would provide feeding, and the entire system is good for the next 24 hours. Then I'm going to take off my gloves, and I'm going to wash my hands and record everything on the intake and output and nurse's notes.